Hepatitis is an inflammation of the liver. Hepatitis type C is usually spread through contact with blood products, and most people don't even know they've been infected. Dr. Jorge Gutierrez of Desert Regional Medical Center in Palm Springs discusses this particular virus that affects the liver.
Hepatitis C becomes chronic in a large number of patients. Of those that are infected with hepatitis C, 70 to 80% will become chronic hepatitis patients. And from those, 20% will progress to cirrhosis of the liver. And from those, about 4% may end up developing cancer of the liver. So it becomes a serious health problem because the simple number of chronic cases that make progression, and currently it has become the #1 reason for liver transplantation in this country. This, interestingly enough, is called the silent disease because many people have it and don't know it. So I think this is a warning to those that have risk factors. The major risk factor currently is the use of intravenous drugs, and particularly sharing of needles. Other risks do exist, but to a much lesser extent. Blood transfusions were a risk before 1991 when the test for hepatitis that helped us detect them before transfusion became available. So the risk in the blood bank has become negligible. There are risks potentially in behaviors such as multiple sex partners to a lesser extent, and particularly if one does not use sterilized or disposable needles when tattoos or piercing is performed. When performed the proper way, those are not risk, but when the needle is shared, then it becomes a risk factor. So contact with blood or blood products in those that are within the family environment, for example, sharing razors and toothbrushes can become a risk. For the treatment, we use a medication by the name of interferon. This has evolved over the past few years to the production of interferons attached to different molecules that make this interferon last longer. So instead of having daily or 3 times a week injections, one can now give once a week injections. And now probably look into preparations that may be once every 3 to 4 weeks injections, which makes it much easier for the patient. And an antiviral medication that's called ribavirin. The combination of those two medications give the best results. It's very important to use the appropriate doses, particularly at the early stages of the treatment. And therefore, a recognition of how to use these medications and a great deal of compliance by the part of the patient are fundamental for the success of the treatment.